Hi, here again is Upstream Health with Ify. How are you guys doing today? I hope you're doing good. So in this video, I'm gonna answer a question about a concern regarding having kidney stone if you're on a green smoothie diet. So for green smoothie diet, we have different types of greens, and not all grains are created equal, and not all grains are high in oxalate. So when you talk about kidney stone in green smoothies, it depends on the quantity you're having, it depends on the type of green you're having. So the one I'm going to be speaking about is spinach. So spinach has, in fact, it has the highest concentration of oxalate. All right, so I'm sure you're wondering what's oxalate. So oxalate, it's an organic compound produced by plants. Actually, plants make oxalate as a way of protecting themselves from predators, right? So when we consume food, this oxalate get into our system, into the blood system, and we have some of this oxalate, like the calcium oxalates, are not soluble, so our body cannot digest that. So it lodges in our intestine, in the blood, in the kidney, and if it's in the kidney, it can cause kidney stone, or for those who already have kidney stone, it can actually make the kidney stone worse. All right, so it's not all green veggies, but you should be more careful about the spinach, because spinach, I believe a half cup contains about over 700 milligram of oxalate, and a healthy individual should be having about, I think, 100 or less oxalate. So it becomes concerning if you're consuming concentrated green smoothies like every day, especially if you're on a green smoothie diet. I know people put up a lot of info about consuming a lot of greens every day. You should find out what kind of greens that you're having. All right, when you have your green, you should make sure it's mixed green, and maybe a handful, 2 or 3 handful of mixed greens every day, not just spinach. Okay, and if you're concerned about having kidney stone when consuming spinach, you can boil your spinach. That can reduce the amount of oxalate in it. And if you're having green smoothies, also I also recommend you hydrate also very properly to help your kidney flush out oxalate from the system. And again, when you talk about oxalate, I know the question was about kidney stone a lot, so I just want to put it out there again. So if you're on a green smoothie diet, especially spinach, the beets, there are a lot of food that are high in oxalate: the spinach, the beets, and the beet green, the sweet potatoes. So when you consume this, like I said, in moderation, because there are other symptoms that you can develop. You can have arthritic pains, chronic joint pains, inflammation. You can have stomach disturbances. You can experience as a matter of fact, it can make autism worse, and you can also have like thyroid issues like hypothyroidism. You find out that you are actually adding weight if you started like a smoothie diet and you find that you're actually adding more weight. Find out, check your thyroid levels, because your thyroid, it could be the oxalate affect lodging in your thyroid, making you have hypothyroidism. Okay, so that you should be very careful. All right, when you consume green smoothies, make sure you're having less of spinach. If you're gonna have your vegetable, it should be mixed green leafy vegetables, and do not, all right, concentrate it by making a lot and drinking at once. Mix it up. Okay, hydrate, and hydrate yourself also when you're having that. And then also find out, when they're making your green smoothies, if you're getting outside, find out what kind of greens that they're using. Okay, I hope I did answer your question. So if you have any other question, concern, and please shoot me that question through my Instagram page. Do have a blessed day. Bye bye.